Let's be straightforward. Many people considered simultaneous polysymbolicity schizophrenia people not only are being considered as disabled, but also defective. And secretly, nearly everyone thinks they are so. Until either yourself or someone from your family one day has a psyche problem. But even then, it's already too late. Too late to claim to be treated as a normal citizen, because the voice from the psychiatry is the voice from the world of the so-called crazy people. The disregard for the mentally disturbed people, especially those suffering from simultaneous polysymbolicity schizophrenia, is also the reason why psychiatry has not lived to see the reliable and true drugs. When an epidemic breaks out, vaccines are ready and effective treatments developed within few years at the latest. Meanwhile, not an epidemic, but a pandemic of psychiatric disorders, including simultaneous polysymbolicity schizophrenia, has been going on for hundreds of years now. And what a civilized modern state has managed to work out to cure millions of people from suffering? The anti-anxiety drugs? Is it serious and dignified treatment for the people suffering from the psyche disorders? Therefore, the therapy of people suffering from simultaneous polysymbolicity schizophrenia must start with ourselves, the so-called mentally healthy or still mentally healthy people. First, a great never-ending education of societies is needed, starting from the kindergartens, ending with the nursing homes, going through the schools of all levels, the unions and social organizations, the religious and sports unions. It's necessary to educate wherever, everywhere, and to understand the mental suffering, especially the suffering of the simultaneous polysymbolicity schizophrenia, as the suffering does not take away even a shadow of the right to a reliable therapy and an equal treatment, equal with the patients from other branches of medicine. Secondly, hospitals and psychiatric wards, as places particularly sensitive to the treatment of people suffering from the psyche disorders, must set an example of dignity in treating these people, and most importantly, every doctor and every medical staff must strive to ensure the reliable therapy. Third, then, therapy, reliable therapy, not counter-effective, but effective therapy. Well, yes, but since there are still no drugs that would remove the cause of, for example, simultaneous polysymbolicity schizophrenia, and thus eliminate anxiety-free periods, how to treat? Undoubtedly, the only possible reliable therapy for genetically determined simultaneous polysymbolicity schizophrenia is an adaptive therapy. Adaptive therapy. Thus, a therapy consisting in acquiring the ability to live and to live a normal life in the society despite the difficulties in mental functioning. The sleepy counterpart of the parallel symbolic psychemi, that is SSPM, sleepy symbolic psychemi, often competes on the verge of sleep and waking with SPM, symbolic psychemi. And this is no problem except when the SSPM is a nightmare setting. Nevertheless, the mankind has developed an adaptation to the competitive situation between the sleepy symbolic psychemy and the symbolic psychemy. And the same, that's the ability to adapt to the competition between PSPM and SPM should be achieved by the people with a genetic simultaneous polysymbolicity schizophrenia disorder. Obviously, before we start such an adaptive therapy of the simultaneous polysymbolicity schizophrenia, people with the genetically determined determined disorder, they must be separated from people with simultaneous polysymbolicity schizophrenia syndrome, which appear due to the use of anxiety blocking substances. Many people with induced simultaneous polysymbolicity schizophrenia syndrome have been treated so far as people with a genetic syndrome. This is a terrible mistake that must be erased first on the blame list of the psychiatry and the psychology to date. The induced simultaneous polysymbolicity schizophrenia and the genetic simultaneous polysymbolicity schizophrenia to distinguish, as I described many times, is not difficult at all. It's enough to talk carefully with the patient and the patient's family. Only genetically simultaneous polysymbolicity schizophrenia patients require adaptive therapy. Patients with the induced syndrome should leave psychiatry as soon as possible and discontinue all drugs treatment, because the longer they are treated as genetically as people with genetically determined simultaneous polysymbolicity schizophrenia, the greater the risk of psychiatrization. In other words, after the initial period of rebellion, many of these people will adapt to the role of chronic mentally disturbed people. Thus, psychiatrization is also a process of patient adaptation, but in the opposite direction that the reliable medicine should promote. This is because out of helplessness in front of the system, a poorly diagnosed young man surrenders and adapts to the role that the system imposes. Unfortunately, this is another of the faults of the current psychiatry, terrible fault with millions of broken lives. Induced polysymbolicity schizophrenia patients should be covered by the civilized state in the program of return to normal life. Their place is not a psychiatric hospital, and the damage made by the psychiatry should be stopped as soon as possible. There is a need for a process of gradual recovery of social competences, and such a program should be implemented by the state, non-hospital institutions. The mentally disturbed people are a powerful army who can work for this country in all its aspects, and often quite quickly, depending on the degree of the psychiatrization of these people. They may regain social competences, enabling normal participation in social functioning within 2 years at the latest. In the case of the genetic polysymbolicity schizophrenia people, of course, before they could go to the program of return to normal life, they would have to undergo the process of the said adaptive therapy in cooperation with the mother psychiatric hospitals and then the psychiatric outpatient clinics. And this must be done in this way. What else? You find out soon.